All right, gang, Dr. D's Health Tip of the Week. The sun is out, spring has finally left us, which was really winter, and we're all wondering, is it time to break out the sunscreen or not? So we're going to talk about, should I be using sunscreen here in regards to this constant debate of my worries about skin cancer versus my worries about adequate fat-soluble vitamin D, a power lifter in the body. Well, this is a pretty easy debate for me. If you are a family with skin cancer history, melanoma, basal cell, squamous cell carcinoma in the family, it is no joke, and these skin cancers can take you out. This is where conventional model shines. If you have a mole that looks suspicious, your dermatologist can snip, cut that out, and you'll live another day, especially with basal cell and squamous cell carcinoma. Melanoma can dig its roots a little bit deeper and be a little bit more complicated. When I was in the backwoods of Indonesia, I actually saw one of the most gorgeous young ladies I've ever seen in my life with an entire elephant leg of basal cell carcinoma. She had a little mole that then took over her entire leg and had to get her leg removed just because she didn't have access to a dermatologist to snip out a little basal cell. So don't be scared of conventional model on this dermatologist shine. And if you're a skin cancer family, or even if you're not, and you see something suspicious, every 6 months we want a full gowned up, I'm going to look at every lesion and mole on your body, and we're going to biopsy these suspicious ones and potentially surgically remove them. So you can do a lot of things naturally to make sure that little micro scar heals nicely, topical arnica, etc., etc. But the big story is, regardless of if you're a skin cancer family or not, you don't want to just get out of school or just get out of work, or the kids just got out of school and we're going to Lake McConaughey, and you're laying in the sun and getting burned right away. Chief Niwot and the Arapaho would have slowly been coming out of their teepee all March, all April, all May, as the sun's waking up. Their melanin, their melanocytes, the cells in the skin that make the pigment or tanning, would slowly be waking up, and they would get that primer tan and then go into a tan. Melanin is protective from skin cancer, but you don't want to just go first gear to fifth gear. So I say, until you pink up, and that's different for olive skin versus fair skin versus African American and so on and so forth, until you pink up, you are making vitamin D. You're taking cholesterol in your skin cells and turning it with UVB rays into vitamin D. Once you pink up, you're transitioning into burning that skin and starting to trigger cell differentiation that's turning into skin cancer. So ease into it. So if you're just hanging out at a park bench, eating your lunch at work, you don't need sunscreen unless you're extremely concerned with skin cancer issues. And let that melanocyte stimulating hormone wake up and start telling the melanin cells in the skin to make tan. So slow and easy does the race. Let's say you just started your season and you're going right into a volleyball tournament at the Boulder Res. You want to lather up with sunscreen because it's your first day out in the sun and you're going to be out playing volleyball for 12 hours. You might even want to reapply. So if you're going from first to fifth gear on sun exposure, definitely use sunscreen. You'll still get some UVB rays and make some vitamin D. Change your latitude. So everyone thinks with the 320 days of sunshine in the Front Range here that we actually make enough vitamin D. And I will tell you, every single new patient I pull blood on has pathetically low vitamin D levels unless they're doing oral supplementation or they're really eating off the land with pasture-raised animals. And that's because of the way the sun hits our skin at Colorado. It's really only the equator region where you can make adequate vitamin D off the sun with enough dietary cholesterol. So the higher you go in latitude, Mother Nature has layered out vitamin D and food sources for us to eat. For example, in Norway, they're going to have that cod liver oil that's packed with vitamin D. They're not going to get a lick of vitamin D off the sun, they're going to get it through oral nutrition. So I always tell people, get a 25 hydroxy, that's a 25-OH vitamin D3 pulled from their doctor, and let's see where levels are at. Below 30 comes with all-cause mortality. You die more of everything. So 30s are minimal. For things like optimal health, turning off autoimmunity, brain health, we want between 50 to 100, depending on the case, but no lower than 50. I feel safe with telling people who aren't my patients, 2,000 IUs, 2,000 international units of vitamin D3, extremely cheap, you can't go wrong with it, you're not going to go toxic. Once you start going 5,000 and higher, you want a practitioner monitoring your blood work. I actually will overshoot the moon and get vitamin D's even into the 100, 110, and then back off on the dosage when I'm trying to change things like autoimmunity or dementia or fibromyalgia, pain, rheumatoid arthritis, etc. So in general, you're not getting enough vitamin D off the sun. It just contributes a little bit, but it's very disappointing on lab, and everyone needs usually at least 2,000 IUs or to really pack in those pasture-raised animal products. So if you can do dairy, if it's grass-fed dairy, you're gonna get some D off that. Egg yolks are super high in vitamin D, as is animal flesh, grass-fed beef till slaughter. In regards to vegan products, these usually need to be fortified to have any real vitamin D, so like an almond milk with vitamin A and D added is also another place if you're not doing animal products. That's Dr. D's tip of the week. We'll see you soon.